Mr. Mayor, we've reached 6:30. We have Councillor Schreider absent. We're just waiting on Councillor Mayette to turn his camera on. There, you may begin.
Okay, thank you, Linda. Good evening, everyone. I'd like to call to order this committee of the whole meeting of the Council of the Town of Saugeen Chores and welcome all members of the committee and everyone who's watching us on the live stream this evening. We're glad that you're with us. The second item on the agenda is disclosures of pecuniary interest. I'll ask any member if you have one of those you'd like to declare. Councillor Carr.
Thank you, Mr. Mayor. I'm going to declare a conflict with 7.2.1 tonight. After seeking some advice from the Integrity Commissioner, I've decided out of an abundance of caution just to step away for this.
Okay, thank you. Further, Councillor Davinsky.
Yes, I have.
Oops, sorry.
Am I not on? I am.
Nope, on. You go ahead. I think the clerk wants to speak after you, but you go ahead, Councillor Davinsky.
Okay. On the minutes, we have 5.1. I'm going to abstain from voting on the minutes because I wasn't a member of council when those minutes were created.
So just to be clear, Councillor Davinsky, that's going to be on the regular council.
Oh, sorry. All right.
We're on the
We'll wait for that then.
Yep, no problem. The clerk got a comment. Clerk?
Thank you, Mr. Mayor. If we could get Councillor Carr just to state the nature of the pecuniary interest.
The nature would be that I am an active member of the volunteer fire department here in Sogging Chores.
Okay, good enough. Thank you. Any further pecuniary interest to declare this evening? Don't see any. So we will move on then to, we have no additions, deletions, or amendments. We have no open forum. So that moves on to delegations. And we do have one delegation. It is from Tracy Murray, Gary Sims, Kathy Beatty from the Saugeen Memorial Hospital Foundation. And they're here to talk to us about the CT scanner campaign. So we'll turn it over to those folks. I see there's Tracy. Good evening, Tracy. The floor is yours.
All right. Well, thank you for having us tonight. Before we start, I do have Gary Sims here with me from CEO of GBHS, and Kathy Beatty was to join us. I don't know if she has logged in yet or if she's trying to. I have texted her. Hopefully she can join us in time. If not, perhaps Gary could cover her points that she was going to cover. Before we begin, I do want to say thank you to council for having us, and also thank you for your past support over the recent years, not only financially with the hospital campaign in the past, but of course, in other ways that you show support. You join our events, you share information about our events, waiving facility fees for our events. So we do thank you for that. And I'm going to hand it over to Gary. I'm just going to share my screen so that we're ready to roll here. If you just give me 1 second. There we go. So I did my thank you. And Gary, if you would like to kick it off, go for it.
Thanks, Tracy. Good evening, Mayor and members of council. Thank you for letting us address you this evening and having the opportunity to speak to you about our plan to bring the CT scanner to Southampton Hospital. As many of you likely are aware, the Ministry of Health does not provide funding for major pieces of medical equipment like a CT scanner. Fortunately, Saugeen Memorial Hospital Foundation has committed to raising $3 million to purchase and install the CT in Saugeen Chores. Without their commitment and generous support of donors, it would be very challenging for GBHS to purchase this much needed technology. Currently, our only CT scanner is in Owen Sound. This CT runs 5 days a week, 10 hours a day as scheduled visits, and is available 24/7 for urgent cases from across our 6 hospitals. We see about 10 people a day from Saugeen Chores and surrounding community. As you will hear shortly from our director, hopefully if she can join us, some of those are urgent cases who arrive at the Southampton Hospital and must be transported by ambulance to Owen Sound, which means a loss of a nurse during that period of time. The addition of the new CT here in Saugeen Chores will allow GBHS to better manage the increased volume of CT patients, reduce wait times, and help us recruit physicians who are used to having these high-tech diagnostic tools in-house. With your support and with the hard work of Saugeen Memorial Hospital Foundation, we will bring Tom to town and deliver even better healthcare services to residents across the Saugeen Chores. I'm not sure if Kathy's here yet. If she's not.
Sorry, Gary. She says she's in, but she needs someone to let her into the meeting.
Ah, okay. We'll see if someone can do that. I'll speak quickly if we're waiting. I just want to say thank you again and for the opportunity to address you and impress the need for the CT in Southampton. It is certainly our biggest, second biggest hospital outside. It's the largest one outside of Owen Sound, and certainly sees the largest volume of patients through its emerge. The reality of that is growing populations and pressures and higher technology for diagnostics mean that we need this technology in order to draw young physicians and in order to keep providing the best care close to home.
Thanks, Gary. Do we have Kathy on board there, Linda?
If not, I can try.
We
I can
have
try.
Patty Wilcox. Will it be under Patty Wilcox's name?
I asked her, she said her screen name would be Kathy Beattie.
We do not see her.
No.
Well, maybe
I don't-
Tracy
well-
and Gary, you can just carry on and
Yeah.
give us the
Yeah,
the highlights and
yeah, happy to. Yeah. So you can see certainly the vast area by which we serve and how the hospitals are located. The key for Southampton and Saugeen Chores certainly is that it's a growing population and high demand for the technology. Next slide, please. Our current CT wait times, as you can see, urgent. We try to meet them the best we can. And unfortunately, with the growing demand, obviously then semi-urgent and routines take longer and longer in order for us to get to see them. Next slide, please. So Graybridge Health Services Owen Sound, CT specialty imaging, historical trend, as you can see, is a gradual growth across the years, and certainly a spike with our specialty in growth is stroke. Cardiac, while it stays fairly stable, our CT guidance and biopsy is also a growing area in demand for us. Next
Hi,
slide.
Gary.
Oh, there you go. You saved me just in time.
I
That's
know
all
you're
right.
doing a great job, though. So I don't want to take over.
No, it's all yours.
I'm so terribly sorry. I was logged in earlier as an admin assistant, and so yes, I was Patty Wilcox. My apologies. But Gary's done a great
no
job.
worries.
Thank you so much. My name is Kathy. I'm the Director of Medical Imaging and Cardiology at Graybridge Health Services. I won't go over what Gary has already spoken to because he did it so eloquently. But I just wanted to speak briefly to why we are here tonight and why we're seeking your support for a CT scanner in Southampton. You've heard my colleagues speak and probably hear some more about the significant population growth in the area and that you've experienced yourself. The capacity for the CT scanner, we are at capacity. Our current CT scanner puts through about 13,500 patients a year. And as the volumes continue to climb, we just are running out of time. We run 12 hours a day, roughly, Monday through Friday. And we offer 24/7 emergency and trauma care as well as stroke care, as Gary mentioned. So we have about 45 patients going through in a day and receiving about 100 recs a day. So we clearly just cannot seem to keep up with the volume that's coming in. The new CT scanner in Southampton would help offset some of the routine imaging that we see in Owen Sound. As Gary mentioned, we do a lot of emergency, but some interventional procedures as well. These are not covered at the other CT scanners within the Graybridge region. Things like stroke, we are the only stroke center in the Graybridge region, and we're the only ones that do the interventional procedures like biopsies, et cetera. So definitely would help offset some of those routine procedures. The Southampton Emergency Department is also the busiest in all of our, aside from Owen Sound, all of our Graybridge hospitals, and we see the largest volume of transfers to this to the site supporting Southampton. And thanks to your lovely renovations that you just recently did in Emerge and at the lab, we actually have the physical space that's sitting there waiting for us at your hospital. So excited for that as well. Next slide, please. The benefits, obviously, we talked about decreasing wait times. The wait times are nothing like we've ever seen before. Routine studies being put out into February right now, which is not great. We do get the emergency ones in right away, but the semi-urgent ones, things like cancer diagnostics, are not being done within that 7 to 8 time frame. So definitely want to see that go down. Care closer to home is huge. Not only to our staff and the nursing staff, but when you're recruiting new physicians to the region, they want those diagnostic tools at their fingertips. So making sure that they have what they need to treat the community is key and critical for us. But obviously, most important is our patients. Having them have that safe and timely access to care in their facility, in their hometown, without having to transfer is huge for them. Strengthen regional CT services. Gary spoke to the map, and we definitely see a gap there in your area. So looking to strengthen up that service delivery. Less inpatient transfers. Every time a patient is transferred over to the Owen Sound Hospital, we're taking key resources such as nursing off of the floor, and that can be upwards of 8 hours, not to mention the patients leaving their areas. And when we take the nurses, that means that other people are running short-staffed and the patients aren't seeing the same kind of care that we would like them to have. Less service disruption for stroke. When we have strokes, we're doing about 6 to 8 a day now, which is crazy. But when we get a code stroke, that means everybody off the table, the team is on standby waiting for that patient, because time is brain and we want to make sure we get the diagnostics done as quickly as possible. So less service disruption if we could do some more routine scanning at the Southampton Hospital. The standardized care across sites. All of our technologists here in Owen Sound are trained in CT. They do everything here, and we would look for the same kind of service delivery in Southampton. We would have similar protocols and just the assurance that knowing that if you're having your scan done at Southampton, it's just as good and high quality as what we're having done here in Owen Sound. And obviously potential service growth at the Southampton site. When we do projects like these, we don't look at not only what's happening today and what our need is today, but we look 5 years, 10 years down the road. How do we see this growing? How do we see the demand and service growing in that area, and how can we accommodate for that? So thank you. I'm terribly sorry about the delay. I'll hand it back over to Tracy.
Thank you, Kathy. So you've heard all the relative benefits and essential elements of this campaign for our community. What we would like to ask is that council consider the information that was presented tonight and the foundation's request for financial support during your upcoming budget delegations. Our fundraising campaign kicked off October 20th, and we are in need of raising $3 million for the CT campaign, Bring Tom to Town. In addition to that, we have to try and fulfill the annual capitalist needs that GBHS has for us as well. So really, we're looking at closer to $4 million. Our first upcoming event to help give a boost to Bring Tom to Town is, of course, Light the Way, which launches next week, and our radiothon, which is December 9th, which I hope to see you all there, which you usually are every day. It's the funnest day of the year. And to wrap it all up, I've sort of mapped out different versions of our requests so you could see what that looks like. A $300,000 request broken out over a 2-year pledge, $400,000 request over 4 years, or a $500,000 request over 5 years. Broken down per home in Saugeen Chores is $1.38 per month per household, according to the 2016 census information that was available. So we have submitted a formal letter along with this information. So that is our request for this evening. We thank you again for your time, and we're certainly available if you have any questions.
Sure. Thank you very much, Tracy and Gary and Kathy. Are there questions or comments from members of the committee? The Deputy Mayor and then Councilman.
Thank you, Mr. Mayor, through you. And thank you, everybody, for your presentation tonight. We know that Saugeen Chores is one of the fastest growing communities, and our hospital is the mainstay of that. Living just up the street from it, I know the number of people that go in and out of it, and bringing Tom to town will be a huge benefit to us. And I know that Saugeen Chores Municipal Council has always helped out, and I'm pretty sure we'll be doing something significant to help out in this fundraising campaign. Thank you.
Councilman.
Yes, thank you, Mr. Mayor, and thanks, Tracy and Kathy and Gary for the presentation. I know this is an important tool, and I know that all of Saugeen Chores will get behind it, just like we always do. If you're looking to raise, that's a formidable sum, but I'm sure we can do it. Is this something that you have to raise the whole amount before we get the CT, or can you get it on a layaway plan kind of thing?
Fortunately, there's no layaway plan, but we do our best to bring it on a time. It's kind of a bit of a parallel event. We try to raise the funds while we try to get the approval at the same time, and we're likely to get the approval fairly quickly. even though we have a multi-year plan for raising it. And, at which point what we'd have to do is borrow money against the proposed raising of funds. Does that answer the question?
I see. Yeah, I think it does. Yeah. And I think Tracy, or maybe it was Kathy, touched on it, that these things is like a microwave oven. Anybody can use it. Anybody in the hospital can jam a patient in there and turn it on and see what's going on inside. That, because I think it's the MRI unit that I used one time for my knee over in Owen Sound, and there was a special technician that needed to operate the machine. Is that not the case for this thing?
I'll let Kathy.
Yeah. Thanks, Gary. Absolutely. No, we do have specialized staff that need to be trained and operate it. Only the medical radiation technologist cannot actually operate it, or a radiologist. But what I was speaking to more so is that the technologists that you have at the Southampton Hospital are MRTs and can be trained in a fairly short period of time, because most of them work over at the Owen Sound site as well. So we cross-train them in various modalities, but it does have to be them. And I hope it's not a microwave. I don't cook you.
Don't put me in it, that's for sure. Councillor Smith, and then we'll get the Vice Deputy Mayor.
Thank you. In addition to the obvious emergency and interventional medical procedures that are accomplished with this piece of equipment, I would just like to re-emphasize as a member of the Sogging Chores Physician Recruitment Committee how important these tools and this technology are to recruiting new physicians to the area. We hear this often when we speak to incoming or potential physicians, that they're looking for access to this type of equipment and much, much more. So I wish you the best of luck in this endeavor, and we'll certainly be here to support you.
Thank you.
Vice Deputy Mayor.
Yeah, thank you, Mr. Mayor. Thank you for your presentation, Kathy and Tracy and Gary. I just a couple comments, and then I have a question too, actually. But maybe I'll start with the question. Once the $3 million has been raised, and no doubt it will be raised, and you've got some very generous and giving communities in our counties here, so there's no doubt you'll do it. It's been done in the past. You do it again. I'm just wondering, once the funds are raised, how is it funded, and how does it impact your operating budget? Just be curious to hear that part of it.
That's a great question. So the operating budget is funded by the ministry, and so we manage our personnel costs through the ministry and the ministry funding. As for the capital cost of replacement, which you would think logically is there's a capital way of doing it, but there isn't with the ministry. So we are, as a hospital, have to manage our own capital through fundraising and through being frugal with everything we do. So it's a bit of a combination of trying to raise the money and manage the money ourselves, as well at the same time as asking our communities to replace that piece of equipment, which becomes more and more difficult every year as we add more technology.
Right. So Gary, 100%, you say 100% funded by the ministry then once the funds are raised?
The operating costs are, which is the staffing costs, yeah, and the hydro, et cetera, which of course, we manage that through our own operating budget.
Right. Well, I certainly will be supporting some form of some kind of a number. I'm not sure what the number is yet. We'll have to obviously discuss it at budget time, but we see your categories, and I'll certainly be speaking in favor of it. We just have to arrive at what we think, the right number is as a council, the budget, no doubt. But it's something, with pledges over 3, 4, 5 year period can be done as well. It's not something that 100% of the dollars have to be up front. Would that be correct?
Correct. Yes. And thank you for your support.
Right. That's all, Mr. Mayor. I just want to thank, I remember talking to Dr. David Billings about this a few years back, and he was very, very keen. I'm sure other doctors are too, no doubt, but I remember talking to my family doctor about it, and was so keen on making this happen. So just thank you to everyone who's been involved to get it to this point.
Councillor Davinsky.
Yes, thank you to Tracy and Gary and Kathy. Appreciate the presentation. Several years ago, I served on the Saugeen Memorial Hospital Foundation Board of Directors, and I was famous for whining, saying, give us a carrot that people can react to. And, there were certain things you need, but they aren't sexy, if you will. And this is the carrot. This bringing Tom to town is a great character, and I hope everyone makes an effort to make sure we realize this. And I too, like the Vice Deputy Mayor, will be supporting this in some shape or form. Thank you.
Thank you so much.
Further comments? I think, I mean, everyone has said it here pretty clearly. This is a pretty critical piece of equipment. This isn't a special piece of machinery anymore. This is routine diagnostic equipment for a modern healthcare facility. And the fact that we have folks traveling to Hanover or potentially Kincardine or Owen Sound from Saugeen Chores, the fastest growing community in our region, to reach one of these basic diagnostic devices is something we can't carry on with. And our community is projected to grow significantly. And as we do, you know, right now, Owen Sound is the only stroke center in the region, but down the road, when the town of Saugeen Chores reaches a population equivalent to or greater than the city of Owen Sound, which is already projected, we're going to need to diagnose those things right here in Saugeen Chores, and we're going to need the equipment to do that. We can't, you know, as you said, Kathy, and it's a great saying, you know, time is brain, and having somebody drive all the way down the road to Owen Sound or to Hanover in a situation like that is something, when you have a population that we're going to have, that you just can't sustain. So maybe that's not something that'll happen right after we, you know, the day after we have the CT scanner, but it's something that we will be able to do or have the capacity to do once we do have a CT scanner. So the first step is getting a CT scanner, and you folks are doing that work, and we much appreciate it. And so we will refer your request to our budget discussions, which are going to happen at the end of this month. And I think you can be pretty confident that Saugeen Shores Council will be making a contribution. So our council will have that discussion, and we'll be getting back to you.
Mayor, could I just say something?
Yes, sir.
I just want to say thank you again for everyone's comments. And I just quickly want to say that, just so people understand, we're presently investing $2.5 million into the HVAC system at the hospital to upgrade where that CT sits so we can accommodate the CT, and to hopefully in the future reintroduce surgery back into Saugeen Shores. So the CT is that opening gate along with the HVAC investment. But I thank you all so much for your time tonight.
Yep. Thank you all, and have a good evening.
Thank you.
Okay, so with that, we will move on to reports of municipal officers and committees. And the first one is 7.2, a general government report. Councillor Carr has his pecuniary interest, so he's going to. Did you have a question first? No, it's not. Okay. And it's a staff report on the municipal service delivery review recommendation report. And we have a presentation by the consultant, but we'll turn it over to Diane Glebe to kick it off. Diane.
Thank you, and through you, Mr. Mayor. I'm Diane Glebe. I've been the town's project manager for the Municipal Services Delivery Review in partnership with our consultant, Strategy Corps. And we're here tonight to present to you the final summary report of this work. With us from Strategy Corps are Chris Loretto, who was the project leader for us and is the management consulting practice leader for Strategy Corps. We have Stacy Hushin, who has been Strategy Corps project manager, and Alex Bernst, who is a Strategy Corps associate. So at this time, I'm going to hand it over to Chris and team to take us through the summary final report.
Great, thanks, Diane, and your worship and council. It's great to be with you again to present the results of the final report of the service delivery review for the town of Saugeen Shores. I'll be delivering the presentation along with my colleague, Stacy Hushin, and I will share my screen now and look forward to taking questions from council. As you'll recall, we were retained to undertake the service delivery review for the town earlier this year. And we undertook a fairly robust approach to getting to the point of the final report here today. There are a number of inputs and that we investigated and analyzed in order to get to the recommendations that we're presenting. First off, we did have the opportunity to look at, internal and external data available to us from the town. We also had the benefit of one-on-one interviews with every member of council, and the senior management team also had the benefit of engagement with staff to really understand the organization, how it was working, and to solicit ideas for where perhaps improvements could be made. We also looked at the town in the context of a set of municipal peer comparators and looked at you in terms of how you're, what it costs you to deliver the various services that you do, how you're structured relative to other peer comparators, as a way of better understanding where there may be opportunities for improvement, but also to understand where Sogging Chores is doing really well, and in fact, leading amongst the peer comparators. And based on all the input that we did receive from yourselves and what we know based on looking at the town quite closely and our experience in conducting these types of reviews, we were in a position to identify 3 priority areas to be tackled for the final report, with recommendations to council and to the team at the town to undertake to make the organization stronger, more resilient, and improve its positioning in terms of delivering the services that residents count on. So, as councillors will recall, we were here in front of you back in August, I believe, to present to you the current state report. And the purpose of the current state report is we don't just jump to recommendations and to conclusions about what might improve the overall efficiency and effectiveness of the municipal administration and the services that delivers. We first really want to undertake a diagnostic and understand how the town is performing. And we had the benefit of presenting that current state to you back in August. And I just want to take you through a bit of a refresher over the next few slides on what we found. We did undertake a bit of a SWOT analysis. And in terms of the strengths that we uncovered for the town, is that the town has committed and dedicated staff. The staff take great pride in their work and are dedicated to getting the job done. And they put the hours in required to deliver the services that your residents count on. There is a resident-centric approach, both at the council level and also with administration and staff. They're committed to providing quality services to residents, and that comes through in the enthusiasm and the way we look at the organization and the hustle it puts behind the services that it does deliver. The town is in a strong financial position. It's a well-run organization with a secure financial future. It's also putting money away in reserves for a rainy day and to make necessary investments, particularly on the capital investments that the town needs to make as it grows, and that's important. And so that foresight that starts at the council level and goes through to the rest of the organization was noted, and it's certainly a strength of the organization. And then last but not least, you have an effective council. Council works well together. And is seen as being aligned on what town priorities are and focused on making sure that those priorities are achieved. We did identify some weaknesses. No organization is perfect. And so we identified 4 principal weeknesses as part of the current state review. We noticed that interdepartmental collaboration could be stronger. In breaking down the silos. This is something that is not unique to Saugeen Chores. It's something that affects all municipal organizations and even organizations that are not municipal in nature. And so there is an opportunity to improve how various departments collaborate to improve the efficiency and effectiveness with which they deliver services. The other thing that we noticed is that there, beyond some things that are mandated in legislation, there are really no codified service standards or associated key performance measures that help to tell you whether or not you're achieving those service standards. And this is not unique to a municipality of the size of Saugeen Chores, but it is a weakness that we did identify, and it's one that we tackle headfirst in the recommendations, which we're about to take you through. In terms of internal communications, it was acknowledged while there has been improvement, there is an opportunity to improve internal communications between council and within the administration itself, within and across departments, so that folks have the information they need to do their jobs better, and that everybody feels apprised as to what the priorities are around the organization and understand the role they play in delivering on those priorities for the organization. And then we noticed that the organization itself, in terms of how it was structured from a departmental perspective, and then in terms of who does what and who reports to whom, wasn't necessarily what the town needs today or going to need in the future as it grows and it continues to have to deliver the services that you're expected to deliver today, but also address some of the new pressures and the new services you'll be expected to play a role in the future. And so, an organization that isn't structured properly makes it difficult over time, no matter how hard people work, to deliver services effectively and efficiently. So this again is another weakness that we identified and are proposing to address with recommendations to you tonight. So at the current state, we did leave council with the 3 areas where we are going to take a deeper dive and make recommendations based on our understanding of the current state of the organization. As I just noted, the first opportunity was in terms of the organization and modernizing the organization and taking an opportunity to not only bring more coherence to how the organization is structured, but also to build in key capacity to help the town deal with not only the service pressures it has today for the services it delivers today, but also being in a position to tackle challenges that council knows is coming at it. Particularly, one example is, affordable or attainable housing, which council has identified as an issue that they want to get ahead of. And so having capacity to deal with that is just one example of where the organization needed to build some muscle mass. The second is around the establishment of key performance indicators, and we worked quite closely with the divisional leadership to really understand their operations and to understand what they were measuring. And it turned out, as we looked at this issue more closely as part of the final report, there are things that the departments are actually measuring and perhaps taking for granted they're measuring those. We use this process to not only articulate and put those down on paper, but also to identify other areas of performance measurement that will help improve the level of transparency to you as a council and to the residents you represent on how the town is doing relative to the services it's delivering, but it'll also help the administration make better informed business planning decisions and be able to provide you that advice through the business planning and budgeting processes on how services can be improved on a go-forward basis. And then lastly, we did notice that there is an opportunity to strengthen financial management within the municipality. You're in a good financial position. The next step is to modernize the finance function. Council, in its wisdom, did have a third party come in earlier this year and undertake a review of the finance function within the municipality. They made a number of recommendations that we're endorsing, so we put that in our report, acknowledging Leading Edge's work, but also as part of the organizational design, we've made some recommendations as to how you can strengthen the function based on those recommendations, so you're in a position to actually execute what Leading Edge has recommended. So in terms of the 3 improvement areas and the recommendations that we're making here tonight, they'll result in a number of outcomes that I think are very positive for the town of Saugeen Shores. First is that the recommendations we're putting forward will continue to put residents first, to allow administration and staff and council and its oversight and its policy setting responsibilities to ensure that you continue to deliver top quality services, that there is bandwidth within the organization to deliver those services, also to tackle some of the challenges that are coming at you and to be in a position to address those on behalf of residents. We think it will also result in even stronger council in terms of your ability to not only address the issues of today, but also to continue on the long-term planning path that you've set for the municipality around capital asset management, housing diversity, development services, things of that nature. we're proposing new capacity and expertise within the organization to support council and making sure that it's not only taking care of what it needs to today, but is also looking out for future generations of residents and taxpayers as well. Long-term fiscal sustainability, the flip side of the previous outcome that I talked about, but also ensuring that you have a strengthened finance function that matches, kind of what is best in class in the municipal sector to perform this function, and putting yourselves in a position to execute on the good recommendations that Leading Edge made earlier this year is going to be another positive outcome of this review. There is new strategic and supervisory capacity built into the organization. So that should result in a better and more efficient management of frontline staff to deliver the services that they're responsible for. It will also mean that the organization's in a position to undertake better business planning and to work with the key performance indicators that we're leaving you with, and evolve your practice over time to make sure that not only are you able to keep track of what you're doing, but are able to translate those KPIs into explicit codified service levels, and being able to use that in future budgeting and other planning processes. The other outcomes to be achieved are that, you'll have a clear performance measurement framework, as I just went through, and starting with a realistic set and approach to performance measurement. You'll have strengthened enterprise functions. There in the organizational review we undertook. There are certain things that are raised to the enterprise level to support not only with the organizational transformation that is coming at you, but also to deal with some of the issues that cut across departments, with strategic initiatives becoming an enterprise function and HR becoming enterprise functions. And then we believe through the restructured organization and the approach to better business planning and the ability to measure performance and moving to a more modern finance function, you'll be better equipped to support that interdepartmental collaboration that we talked about and identified as a weakness, and be able to turn that into a strength for the organization and for the residents of the town. So before I turn it over to Stacey, I do just want to talk about how we approached and what recommendations we are making with respect to the organization of the town. In undertaking a review of the town's organizational structure and looking to make recommendations as to how to enhance and improve the overall structuring of the organization, we were guided by 5 principles. And these are principles that we apply in other municipalities where we've undertaken this type of work, and they're based on not only what we observed in the sector, but also based on leading practices research. One, we always look to streamline management accountabilities and optimize the span of controls to make sure that no one manager, no one director within the organization is disproportionately responsible for number of staff or functions, making sure that there is an even distribution of work and direct reports within the organization. We also want to make sure that there is an alignment of staff reporting within an organization that makes sense and helps people understand where they fit in within the organization. Also helps you as a council and residents understand how the organization works. The second principle is that we look to elevate centers of excellence to drive continuous improvement, and that's why I just touched on the need to make human resources, and also the need to make strategic initiatives, enterprise functions. So there are things that those issues that they deal with, and the challenges that they're expected to help you address, cut across departments, and so having those as enterprise functions is important. The third principle is to deliver on strategic and operational priorities. So looking at what the priorities are of the organization, and having an organization structure set in place that helps you actually deliver on those, where there is clear articulation of roles and responsibilities, who's ultimately accountable for things, how that accountability structure works, and making sure that that is delivered on. The last 2 principles are grouping like functions within departmental structures. So bringing like functions together under the same department or same unit within a department is important. There are synergies oftentimes to be gained by having folks that are either looking at similar issues and dealing with similar issues or performing similar work, being together and being able to figure out how they can work together to perhaps better use the capacity that is available to deliver the services they're responsible for. And then we do look at it in terms of the, how you would compare with other municipalities. What are other municipalities doing that is interesting and leading edge that could be adopted or adapted to support the town of Saugeen Shores? So part of the peer benchmarking looked at how those organizations were structured and how they aligned accountabilities and responsibilities, and using that as a frame for looking at your organization. So in terms of recommendations, the recommended organizational structure enhances key accountabilities and reporting relationships. We are recommending that you move from 7 departments down to 5 departments with clearer mandates and responsibilities that they're responsible for. The new structure is set up to create new capacity in several key strategic and operational areas. This is important for a number of reasons. Not only to ensure that you're making the most use of the people resources and the processes and technologies that you have within the organization. It's also about ensuring that you have an ability to manage succession risk. And so if somebody were to leave or to retire from the organization, you have folks within the organization who can step up and take on key responsibilities and not interrupt services to residents. And this will also ensure too, that having this capacity better positions you to deliver services, be able to track and monitor and report out on those services, and continue to evolve those services over time. So in terms of the new structure and what it looks like, it's presented here on this slide. There, as I said, in the office of the CAO, we are recommending that human resources and strategic initiatives be direct reports. And in the office of the CAO, they become enterprise functions working across all of the divisions, and they become strategic resources, particularly strategic initiatives to council through the office of CAO as well. There are 4 realigned departments: fire services, corporate services, development services, and community services and operations. Fire services mandate is the fire service. It continues to be responsible for healthcare and emergency preparedness. That includes physician recruitment. The corporate services department doesn't change much, other than that the clerk's function comes into the corporate services department, and the finance, clerk, and information technology responsibilities are resident in that department. The development services function that are currently within the various existing divisions of the organization are actually consolidated into a new development services department. And this includes engineering services, a new expanded capacity for asset management to support long-term asset management planning, long-term capital budgeting. Planning and development services and building services are all under the umbrella of a development services department. And then community services, so recreation and tourism, along with public works, basically, in the public works operations are under one new division in community services and operations. And so that streamlined organizational structure makes it much clearer who's responsible for what, and ensures that there's sufficient capacity to deliver the core services, and to also be in a position to respond to new pressures that are coming at the municipality. Those resources are in place. This really does set up the organization not just for the next few years. We believe this sets the organization up for the next decade to be able to manage the growth pressures and the expectations that come with those growth pressures for municipal services. So I will turn it over to Stacy to talk about our recommendations around performance management and key performance indicators.
Thanks, Chris. So part of our kind of approach in terms of setting the organization up for success over the next decade includes building a performance measurement plan that, the organization can start pretty much right away and continue to grow and refine over the next several years. So, as Chris mentioned at the outset, the lack of consistent and consistent and constantly measured and reported on key performance indicators was noted as a weakness in the organization. So as Chris said, one of our recommendations is to build key performance indicators that can be measured consistently and annually reported back to council so that you can measure how the town is doing and where there may be opportunities to improve, where there may be needed investments or staff resources and things like that. So it can essentially support the town in making database decisions. So, determining where to allocate your dollars. It can help you identify where there may be gaps. So, maybe where you're not meeting your service level standards that you've set and what needs to happen there. And then the third piece is that it allows you to make changes, be agile in making changes and pivoting to respond to what the data is telling you in terms of service levels, resources. So, through key performance indicators, you'll be able to answer key questions. Are we in alignment with our strategic plan? Are we providing services well? Are we complying with our legislative requirements in certain divisions? Those exist and you're required to do that. Where do we need additional staff resources? Do we need additional staff resources? Where should we be allocating budget dollars? Key performance indicators, in a lot of ways, is the backbone of some of that core decision making for the town. So Chris, you can move to the next one. Thank you. So in terms of actually building out a performance measurement plan, we've laid out a bit of an approach here for you to support the town in doing that. The first step was really this process. Through this process, and you were all involved in the current state report review in August, we developed a number of service inventories that laid out the staff complement, what services were provided, really the nuts and bolts. The next step is really to look at, well, what are our service levels? What are the standards? And these are, determined through the resources approved by council, the volumes of service delivered, as I said earlier, your legislative requirements. The next step, once you've done that work, is to kind of set those targets. And in previous reports, we've identified some targets based on best practice. But other targets may be council direction in terms of, for example, the number of attainable housing units you'd like to build over the next 5 years or annually. Other targets, of course, are set for you through legislation. So then the final step is determining key performance indicators.
Sounds like we've lost or are losing Stacy.
I'll pick up for her then, Your Worship, while
Yeah,
she's dialing back in. So the first part of the process is setting that baseline, understanding what you do today, and what does that translate to in terms of the service level that you're doing. Then setting targets relative to that. Do you want to do more? Do you want to do the same? Do you want to do a little bit less? And then, understanding what you're going to do and the level that you're going to be delivering to, setting the key performance indicators in place that will help you understand whether or not you're getting towards your goal of where you want to be from a service delivery perspective, monitoring, assessing your performance against those key performance indicators, and being able to report to council on those, and helping council understand what that performance means, not only in terms of achieving objectives, but what it might mean from a budgetary perspective in terms of where resources may be needed or how resources may need to be reallocated, and or if you're achieving things, what the next step might look like if there is a next step to be achieved from a service perspective. And so this framework we're leaving you with is something that, and we, as part of the process, we have identified key performance indicators within the both the departments as they exist today, but also the departments as they may exist tomorrow, subject to council approval. But we'll set you on a course to begin with a lighter touch, because we don't want the organization to be overwhelmed. We don't want the organization to be paralyzed by performance measurement. That is entirely possible. We want it to be practical. We want to be able to see it translate into how you make business decisions, how you make budgets, and then how you report and help folks around this table and also folks in the public understand how you're performing. And you'll be able to evolve your practice as you get more comfortable with it, and as you continue to grow as an organization. So in terms of the principles, I stole my own thunder a bit. We are recommending that you do start small. We've worked with the departments to identify a core set of indicators. We tried to keep it to the rule of 3: things that matter, things that are substantive, things that affect big parts of the operation, and things that will be useful not only for management decision-making purposes, but for the purposes of informing you and helping you in your decision-making rules around budget planning and other things. Focusing on activities that are already measured or could be quickly measured is another principle that we took to identifying some of the measures that we've left you with. We didn't want to make this more complicated than necessary. We didn't want to come down with the consultant's Bible on how to do performance measurement. We wanted to make sure it's things that people could get comfortable with quickly. And as I said, in working with the departments, we came to realize that they're already measuring certain things and maybe just not sharing it or taking for granted that they're measuring those things, but that's important. And now seeing it filter into business planning and budget planning and so on and so forth, work planning is important, and ensuring they're authentic. So like I said, we didn't, you could spend years studying performance management and you could create the perfect system, but if nobody's going to use it, then it's foolhardy to do so. Making sure that, again, those KPIs that we've identified and the approach that we've taken is practical, it's realistic, and it's meaningful to people in the department that they're managing, or the unit that they're managing, or the day-to-day service that they are delivering, so that there is that buy-in. We made them practical, keeping them practical, and then including different measurement tools. So, there's no one right way. Some services are more tangible, more they lend themselves to quantitative measures. Some are less tangible, more qualitative. And so, where it's difficult to quantify, we may be looking at trying to measure quality and satisfaction with the service, and using that to inform how we're performing and how we may need to invest or redeploy resources to perform even better. And so, as I said, we looked at the current structure of the organization, the future structure of the organization. We did KPIs for both of those, subject to not prejudging what council is going to decide. And so the toolkit is left with you as part of this process. In terms of implementation, we're recommending a 1 to 5 year implementation process. Those things that departments are already measuring, you can start right away using that to inform business planning, which we know that the departments are doing, helping to share some of those through the budget planning process, which I know you're about to get into prime season for that, and helping you understand what that means in terms of the decisions you're making is where we suggest you start. Some things are going to take some time to actually figure out, okay, what is our baseline? How are we going to measure against that? What is the target that we're going to set? That will take years. Again, starting practically, starting small, growing from there, and not biting off more than you can chew is really important, because at the end of the day, we want people focused on the service and the right measures to help inform how services can best be delivered. So this just sets out a little bit in terms of the implementation timeframe. There are key, there are activities, because we're not, as part of having the toolkit set, it's not just turning it over to directors and management and staff and say, go have at it. There are things and supports and training that you're going to want to do to help folks do this successfully. Hence, part of the let's crawl before we can walk approach that we have recommended. And then, building them over time and having transparency, not only within management, but with council about, what are the service levels we have? What are the indicators that we have set for ourselves, and how are we going to report and assess performance and use that to inform business decision-making? The last part, Your Worship, of the report is around what Leading Edge had to recommend for improving the finance function of the town earlier this year. There are actually five core recommendations that Leading Edge made in terms of integrating how accounts were administered, particularly water and property tax accounts, being able to consolidate those and have an individual do those, using e-billing services, cleaning up and improving policies and procedures around accounts receivable, the accounts receivable function and the reporting around that function, enhancing the budgeting process and ensuring that not only do you have the tools within the finance function to do it, but also taking a multi-year approach to looking at how budgets are created and also ensuring that there is greater integration of line departments in the budget process, and that the service folks are informing the finance folks on what needs to be true in the budget, and then enhancing the purchasing function, ensuring that there's clarity around policies, but also procedures and templates and contracts that are there to support your procurement of goods and services for the municipality. We have taken that, we've looked at it in the context of organizational redesign, and we provided some specifics in terms of how you would structure it so that you can deliver on those recommendations. And the other piece that we did was we did look at it from a performance management perspective, and we have set up some KPIs that we think are within reason, within a reasonable time frame that the finance function can be on top of, and are really important from a kind of a governance and fiscal accountability perspective to you as counselors as well, in terms of understanding and getting better reports around how you're performing relative to the budget, how are the investment of your reserve funds working relative to industry or market benchmarks, things of that nature, greater transparency and better information to support your own decision making as a council. So with that, I will conclude our presentation. Again, thank you very much for the opportunity to work with you. You have a great organization. I believe we're leaving you with a toolkit and a structure that will position the town to address the significant growth challenges that you face and continue to deliver high quality services that your residents have come to expect from you well into the future. And with that, Your Worship, I will stop our presentation.
Okay, thank you very much. So I do have a recommendation. I'll read the recommendation and then we can take questions or comments. It's recommended that council approve the recommendation report summary prepared by Strategy Corp as the recommended approach to the restructuring of the organizational structure of the municipality, and that council approve the incorporation of the funding amount of $329,271 into the 2022 draft budget, and to bring forward the projected 2023 amount of $397,705 to support the implementation of 7 net new positions by 2024. Questions or comments from members of the committee? Vice Deputy Mayor.
Yep. Thank you, Mr. Mayor. And, this report obviously is something we had to do as a municipality. We are growing to 20,000 people by 2030, at least that's what we're projecting, where the numbers are heading, and we need to prepare for the future. And I think for me, it comes down to what identifying service levels, and what are the kinds of service levels we want to reach, and do we have sufficient staff in place to handle those service levels. So for me, that's really what comes down to is there level of service. I did have a question for you, Chris, or maybe our CIO Care. I'm not sure who this is directed to, but as our population grows, you've got that many more hectares of grass to cut, and you've got that many more accounts receivable and payable and facility bookings and building permits and water bills and payroll, and that's growing. And I see, with the positions, you do have some middle management and some of those positions right dead in the middle. But I'm just wondering, how long is it going to take, Kara, maybe to see you come on? As we do grow and we're adding those 7 positions by 2024, how long will it take for us to take a look at those, with the KPIs and the whole process we're looking at buying into here, to address the support staff, I guess is what I'm talking about. Those extra hectares of grass, I mentioned those 7 or 8 areas, because, it's great to have management in place. I think we had to do that first. But at what point in time and how quickly will we be taking a look at providing support staff? I know some of this does it, what I'm hearing tonight. But how long is that process going to take?
Thank you for the question. And through you, Mr. Mayor, I think that in Chris's presentation, he sort of spoke to the need for the municipality to establish, you referenced by Deputy Mayor, the service levels and the key performance indicators. And when we really started looking at how we would, the entirety of the organization and what was needed throughout it in order to support those pieces you're talking about, what we learned very quickly is that we didn't have the data in order to really build what I'm going to call the business cases around those positions. So what you see in front of you tonight is a plan for Sogging Chores to really start to track service levels, to track those key performance indicators. And then through our annual budget and business planning conversations, that's where I would see the business cases starting to be developed for those service levels and the resources that are needed in order to support that continued high level service that we see here in Sogging Chores.
Okay, that explains it. Thank you.
Thank you. Further questions or comments from members? Any questions? I guess I'll just, well, first say thank you to Diane and to our consultants at Strategy Corp for all of your work on this. This is a very detailed report covering, well, really covering the entire organization and positioning us as you've described for the growth that we're going to experience. And we've talked about this before at council and with you folks that, you know, the municipality is really transitioning from a smaller organization to a more medium-sized organization or even a larger size organization. And that change requires some fundamental alterations to how you organize yourself. You know, you need to have some additional structure to ensure that you can monitor all that you need to monitor and manage all you need to manage to ensure that you know, we're providing ultimately value to the people who pay taxes in the town of Saugeen Shores and efficiency and using their money the best way we can to deliver the best services we can to them. And so that's what we're doing here. It's, I think, a really tremendous opportunity for everyone in this organization to reach more of their potential and achieve more as employees of our municipality and go further and do more and ultimately be a stronger organization. You know, we have in the town of Saugeen Shores, and I think perhaps we don't say it enough, we have a very deep bench of staff. We have a staff that right from the most junior position to the most senior position work extremely hard and put in an awful lot and push this municipality forward in every way possible. And this, I think, this new structure, I'm hoping, is an opportunity for this council to give that staff the tools it needs to do even more and go even further and be stronger as a team and achieve more, which I know they want to do. So, so I think it's exciting to see. I'm looking forward to seeing it roll out, and I want to thank you all for the work you've done to put it together for this council. And yeah, thank you. So you've heard the recommendation. If there's nothing further, then I will ask all in favor. That's carried. Thank you. All right, then we're moving on to the second staff report, which is on the sidewalk patio and sidewalk cafe encroachment policy revisions. And we'll turn that over to the Economic Development Officer.
Thank you, Mr. Mayor, and through you. In 2020 and 2021, as a response to the COVID-19 pandemic and its impact on local businesses, Council approved temporary revisions to sidewalk patio and sidewalk cafe encroachment policy. Revisions to the original policy included the waiving of fees for businesses, the addition of retail establishments, the lowering of insurance liability, and approval of applications by town staff. Town staff are recommending that these policy revisions be made permanent due to their success over the last 2 years. We have also heard support for the continuation of the policy from the Mayor's Task Force and attendees at this year's Economic Development Forum. Additionally, opportunities are being explored to develop pre-approved patio specifications for businesses to adopt and implement for the 2022 season. And with that, I'll take any questions.
Thank you. Well, we have a recommendation. I'll read it and we can take questions or comments. It's recommended that council approve the 2020-2021 revisions made to the sidewalk patio and sidewalk cafe encroachment policy as permanent changes. Questions or comments from members of the committee? Councilor Grace.
Thank you, Mr. Mayor, and through you. And Heather, thank you for the report and thanks for all your work on this. I know this has been really a successful policy through the last 2 summers. And we've seen how that flexibility has really not just helped our restaurant owners and cafe owners, but also I think really revitalized our downtowns and made them very vigorous. But I do have a question about the reduction, the suggestion or the recommendation of reducing the $5 million liability coverage, which is, I understand, something that our insurance company prefers as opposed to $2 million. Mr. Mayor, I'm not sure how to proceed, but I would like to suggest that for that particular part of the policy that we don't make that permanent, that we come back and review that in a year and see where we are. And I just think that's more prudent. It would still allow us to support the business owners, but still also allow for us to protect our interests going forward in another year.
Sure. So, for tonight, what you have before you, you've all read the document connected to this recommendation. You have the 2020, 2021 revisions sort of in draft form there for you to look at. After council has its discussion tonight, and if we pass this recommendation, the new policy, if you like, or the newly revised policy will come back in its final form for us to consider. And so based on our conversation here tonight, I'm sure Heather will take note of what's said here tonight and bring back a final form that sort of takes into account what council suggests here tonight. So we've heard your recommendation, your suggestion there, and we can hear from others and see what they think about that or other things, and then Heather will take notes and return with a final version for us. Councilor Davinsky.
There we go. Yes, I read this report, and like Councillor Grace, I'm a little concerned about the insurance from 5 million down to 2 million. In the report, there were phrases like offers reasonable protection, likely cover most scenarios was another phrase. And town could and may provide for additional layers of protection. These phrases, and I'm not saying it was done surreptitiously, but these phrases concern me because I've always been a believer in the $5 million insurance, and maybe we take it slow and just review it every year. But that's my comment on this, just a little concerned.
Sure. Thank you. Further comments from members? I guess I'd make a comment with regard to that. This is one we've kind of gone around the horn with a lot over the years. I remember when we revised the sign bylaw to allow for perpendicular signs at that time, there was a requirement that there would be a $5 million liability insurance provided by business owners for that. Our insurance company is always going to ask for more insurance. That's how they make money. So they're always going to say you need $5 million, more insurance, more insurance, more insurance is good from their perspective. the key thing to look at is how many settlements have there been around sidewalk patios that have gone over $5 million against in favor of the claimant. And my guess is there's not that many. I mean, we could look at that, but certainly at that time when we had to look at it around perpendicular signs, it was essentially unheard of. I would be very surprised if there's an awful lot of liability waiting out there for us at $2 million. There's a risk at every level, however much insurance you have, and there's risk to all these things. The alternative, though, hits a business owner very hard, right? A $5 million, the difference between a $2 million level of insurance and a $5 million level of insurance costs them an awful lot of money. And this is something I heard at the Economic Development Forum pretty clearly from businesses. They like the patio revisions, but they're concerned about those insurance rates. And that was something we heard around perpendicular signage years ago too. I think the level of liability that the municipality is going to incur, when you hold that up against the level of pain that inflicts on the business owner, I would say I'd be willing to have the municipality bear whatever risk we might bear there, so that we can offer that opportunity to those business owners. So I'm in favor of the $2 million, and I'd be in favor of making it permanent. But if council's wish is to review it in a year's time, I'm fine with that. It doesn't bother me, but I'd certainly like to see it remain in the policy at $2 million, and we can revisit it if that's the desire. Are there other comments around that or anything else in the policy? I don't see anything. So Heather, why don't you bring it back with the $2 million in, but with a clause that will review it in a year's time. Okay.
Thank you, Mr. Mayor. Will do.
That's satisfactory to everybody. Looks so. Okay. So thanks, Heather. So we have the recommendation. I have read the recommendation. You've heard it, and with recognizing the conversation we've just had, I'll ask all in favor. That's carried. Okay. So that moves us on to 7.3, infrastructure and development, and staff report on pre-servicing agreement for the Hampton Woods subdivision, and the director of infrastructure and development.
Thank you, and through you, Mr. Mayor. Hampton Woods is a subdivision located on Division Street, just south of the Southampton Golf Course, and it is a proposed development of 39 rental townhouses. The pre-servicing agreement allows for the infrastructure to be constructed with the appropriate level of securities to protect the town. We're recommending council sign the agreement to allow the development to move forward.
Thank you. There's a recommendation. I'll read it. And it is that council pass a bylaw to authorize a pre-servicing agreement for the Hampton Woods subdivision. Questions or comments from members of the committee? The Vice Deputy Mayor.
Thank you, Mr. Mayor. More of a comment, Amanda. I think you maybe I was in discussion with Jay today about the fact there's one line in here that's intriguing, and that's the developer intends. I know this is a site servicing agreement, but the developer intends to operate the housing as rental housing, and that's a good thing for our community. Do you have those numbers, 1, 2, 3 bedroom at your fingertips, Amanda? In terms of the numbers of 1 bedrooms, numbers of 2 bedrooms, number of 3 bedrooms that he is proposing there?
Through you, Mr. Mayor, I don't have them with me, but we can get back to you on that one for sure.
Maybe just send those out to council if you don't mind. And again, I know it's a site servicing agreement, but that is a nice line to see in there that there will be 11 units for new rental housing in our community. Thank you.
Thank you. Further questions or comments? Seeing none, all in favor? That is carried. Okay, that moves us on to the final staff report under infrastructure and development, and it's a staff report on the asset management plan for core infrastructure. The director.
Thank you. And again, through you, Mr. Mayor, core infrastructure is what is defined in this plan. And that was really the biggest update, was to make sure that was clear that this plan was limited to that infrastructure. We presented the same plan in August to council, and now we're looking for council's approval so that we are ready to go for July 1st to send to the province for final approval.
Okay, thank you. There's a recommendation that council approve the 2020 asset management plan for core infrastructure in the town of Saugeen Chores. Questions or comments? The Deputy Mayor.
Thank you, Mr. Mayor. And through you, in our organizational review, fleet has now been put under the asset management plan. Is fleet to be included in this plan, or is this everything else but fleet?
Through you, Mr. Mayor, fleet and facilities will be the next stage of the asset management plan, which is due to the province in 2023. So this first stage is just core infrastructure.
So who will be monitoring fleet purchasing in the upcoming budgets?
Through you, Mr. Mayor, again, that's not part of the asset management plan, but that right now, Kara has asked that for the public or for the capital budget that I present those purchasing opportunities that were done through the fleet committee over the summer. So that group of individuals has already made that recommendation, and I'll present them as part of my budget presentation.
Okay, thank you.
Further questions or comments around the asset management plan? Seeing none, all in favor? That's carried. Okay, thank you. Then we'll move on to 7.7, communications and petitions for information, and 3 items there. Any questions or comments with regard to any of those? See any? I do note the Roma conference information there, and the opportunity to meet with ministers and parliamentary assistants. And I am aware that the county is working on some opportunities to talk about housing at Roma. And I think, and at our conversation at County Council last week, we talked about an opportunity to perhaps collaborate with lower tiers in making those delegations. In particular, some of the work that Saugeen Chores has done in delegations with ministers in the last while at AMO, Councillor Smith and Kara were involved in that delegation. We had some traction there, and the county was interested in that. So, anyway, I think there's some opportunities there for us to work with other municipalities in the county to continue to further advance some of the things we hope the province might do to help smaller municipalities deal with the affordable housing crisis. So, just a comment, I guess, for the time being. If there's nothing else on any of those, then we will move on to reports of department heads. And the first one is the Economic Development Forum report and the Economic Development Officer.
Thank you, Mr. Mayor, and through you. The hosting of an annual Economic Development Forum is a recommendation in the Economic Development Strategic Plan. On October 26th, the 3rd Annual Economic Development Forum was held, having been postponed in 2020 due to the pandemic. These annual forums with economic development stakeholders have tremendous value. The input from participants is used to ensure that town staff and stakeholders are moving in the same direction. This year, participants provided valuable input on the discussion questions provided, and some of the key themes that emerged from each of the topics are outlined in the report.
Thank you, Heather. Are there questions or comments for Heather on the report? Seeing none, I just wanted to say thank you to you, Heather, for organizing that. It was really well done and really well attended. Some really exceptional people from across our community were there, gave some great input that I was interested to hear. And I'm looking forward to next year's event. Hopefully we can, we had to take a bit of a pause because of COVID, but hopefully we're back into a routine of doing these every year because I think they're really valuable. So thank you. And then that moves us on to our second report, which is an information report on the Southampton Water Pollution Control Plant Draft Environmental Study. And I assume we'll have the Director of Infrastructure and Development speak to that. There she is.
Sure. Thank you. And through you, Mr. Mayor, this is the same plan that we presented previously and has gone through the public process. This is the last stage. Answered those questions that were asked, and the 30-day appeal period will start tomorrow if you approve this report.
Thank you. The report isn't up for approval, just here for information, but if there's any questions or comments, I'm sure the director will answer them. Councillor Grace.
Thank you, Mr. Mayor, and through you. My thanks to Amanda for providing this information. It's not really a question, but it was my question in our last meeting about the climate change adaptations and mitigation measures that are being built into this new plan. And I just wanted to draw attention to that. the fact that there has been, I think, a lot of thought given to, providing methods of mitigating situations where you might have a very long duration rainfall or freeze thaw cycles. And I just think it's important for the public to understand and realize that those kinds of measures are being built into the plan. Thanks.
Yeah, thank you, Councillor Myatt.
Thank you, Mr. Mayor, through you. Yes, thanks, Amanda, for bringing this back. The other question was mine, and as I expected, it's in 2021 dollars. So, basically, the sooner we get these things done on those plants, the better, the cheaper it'll be. The longer you put them off, escalating costs, particularly over the past year or so. That clarifies it for me. And just on the second part, though, too. There's been some questions from the public recently about situations like this where you might have high peak flows for either environmental reasons or for peak reasons, whether it's at the Port Elgin plant or the Southampton plant. But just for clarification, we're putting in, there's going to be some tanks put in there to handle peak flows, right? So there'd be attenuation tanks, I think you've called them. And so we have never had any reportable accidental discharges from either of our sewage treatment plants over the past 10 years, say, have we?
Through you, Mr. Mayor, definitely not in the last 5 that I've been here. We've had spills and other areas or reportable instances where generators have been down, but we haven't had bypasses that we've had to report to the river for the plant. The operators run it right now where they handle the peak flows through the plant, but you're right, this equalization tank will be what's put in to accommodate peak flows.
Right, and in the Port Elgin plant, we have enough capacity that we have that already built in, right?
Through Mr. Mayor, that's true. We have the plant was sized larger. Next year, we're looking at proposing to increase the inlets. So there are pieces of capital projects that keep going on in these plants to do the expansion. Port Elgin's sort of they're more ahead of Southampton in that this was planned as the last time that it was built, and we're still working through that. But we'll start the process again on Port Elgin soon.
Terrific. Thank you for the responses.
Okay, further, the Vice Deputy Mayor.
Thank you, Mr. Mayor. I did have a question raised to Amanda. If I could ask you, this question came from a constituent. Have either plants been at risk at all during peak flow season, particularly when tourists are back in town, the population surges? And have we ever been at risk in the last 1 to 2 summers for a sewage plant?
Through Mr. Mayor, no, would we get reports from Aqua every month on the flows that we're seeing at the plants? And that's what made us start this Class EA. So once we hit that 80% capacity as a trigger for us to start looking in to make sure that we don't meet that. So we keep a monitor on those flows and we know where we're at. And that's how the timing of these works is put into place as well, so that we stay ahead of that risk of reportable events.
There's never been a moment or a time where we've been at risk then. Thank you.
Further comments or questions? I know that it's interesting. I know that there's some, as the community grows and people see neighborhoods being built in the community and things developing very rapidly, I know it creates some anxiety for some people that, these core services might be at risk, whether it's water, whether it's sewer. And I think it's really important to be very clear with the public that the municipality, although these houses are going up in real time, the municipality has been aware of that this growth has been coming for a very long time and has been building out its infrastructure to prepare for this for a very long time. And we're well prepared for it. And we continue to make, this council, previous councils, continue to make annual investments in water treatment and our sewage treatment facilities to ensure that we are well ahead of the curve when it comes to keeping up with the growth of the community. So folks needn't be concerned that we're going to fall behind this. And the work we're doing today is planning for growth that we're going to experience tomorrow. Our goal, and because we have good people like Amanda and her staff and Aqua, they're making sure we're staying ahead of this curve, bringing recommendations to this council, and this council, in my experience, has always approved all of the capital improvements to our water and sewer plants to ensure that they're well ahead of the curve and able to serve the growth. So I know I've heard some of this anxiety myself lately, and I think it's something we just need to keep reminding the public that we have good staff and we're well prepared to handle this growth. If there's nothing further on the information report, then that brings us to the end of the committee of the whole agenda, and we'll take statements by members and the deputy mayor.
Thank you, Mr. Mayor, and through you, lots going on in the communities, but tonight I just want to say welcome to our newest member of the Saugeen Shores Municipal Council, Councillor Davinsky. Hope you enjoy your next 12 months, and well done so far.
Thank you, Vice Deputy Mayor.
Just ditto to that, John. Welcome to Saugeen Shores Council, and I know you're going to do a terrific job, so welcome.
Thank you, Councillor Smith.
Nothing for me tonight, thanks.
Thank you, Councillor Grace.
Thank you, Mr. Mayor. And John, welcome to Southampton Ward, and I'm really looking forward to working with you. It's going to be great to share that responsibility.
Okay, now it's time for the big opportunity. Councillor Davinsky.
Thank you, Mr. Mayor. Through you, thanks to everyone for welcoming me here. And I have one announcement. I want to make sure everybody remembers this Thursday is Remembrance Day. And of course, Southampton Ward will be having Remembrance Day at the Cenotaph. So you're all welcome there. And I'm sure Port Elgin is doing the same thing. Thank you, Mr. Mayor.
Thank you, Councillor Carr.
Nothing for me tonight. Thanks, Mr. Mayor.
Thank you, Councillor Wyatt.
Yes, Mr. Mayor, thank you. Just a shout out to the Steelheaders organization to keep my fish theme going. The Steelheaders in Southampton had an event this weekend, and a one-day event, a tournament, and they raised a whopping $16,000, which has been distributed to area conservation groups, not the least of which is the Lake Huron Fishing Club. So thanks to all the organizers and Cody Buchanan, who led it off, and all the Steelheaders for their great work. And it's a good example of the type of economic activity that fishing and angling brings to our town in November, which is, shoulder as it gets. So shout out to those guys.
Very good, thank you. A couple of things from me. One, that just today, actually, I went around with the County of Bruce to a number of local businesses, 7 actually, to celebrate them receiving Spruce the Bruce grants in our community. And lots of amazing work happened across our community this year because of Spruce the Bruce grants. Patios got expanded, facades got improved. And so it was great to visit those businesses today and congratulate them on getting those grants. And the other thing I wanted to mention to council is that last Wednesday, myself and the manager of development services met with representatives of the Blue Water District School Board to talk about the need for a new school, an elementary school in the town of Port Elgin in particular. And so we're continuing to stay on that. And I really wanted to raise it primarily to say thank you to the board officials who took the time to have that meeting. They are very dedicated to this town and to getting that expanded school space that they know we need. It's just a matter of convincing the province. And so the town and the board are working closely together on that, and I'm looking forward to hopefully making some progress on it. But with that, that brings us to the end of the committee of the whole. So I'll ask for a motion to adjourn. The Deputy Mayor, Councillor Grace, all in favor. The committee stands adjourned, and we'll reconvene at 10 after 8.
Mr. Mayor, we've reached 8:10, and we're just waiting on Councillor Mayette. Councillor Mayette, are you there? One last call. Can we get Councillor Mayette to turn on his camera?
We'll carry on, Linda, and
Thank you.
we will catch up when the time comes. Okay, so we'll call to order this regular council meeting, and the second item on the agenda is disclosure of pecuniary interest. Ask any member if you have one of those to declare at this time. Councillor Carr, and then we'll get Councillor Davinsky.
Thank you, Mr. Mayor. I'm going to declare a conflict with item 7.1 as well as bylaw 86-2021. My reason for calling the conflict would be as I'm an active member of the Sogging Chores Fire Department.
Thank you. Councillor Davinsky.
Thank you, Mr. Mayor. First of all, I just want to say that I will abstain from voting for the minutes of Council 5.1 because I was not a part of Council at that time. And also within the Committee of the Whole minutes, October 25th, item 7.6.1, the Bruce condominium correspondence that was handed out. I have a conflict there in that I reside in the complex.
Okay. Thank you. Sorry. The clerk.
Sorry, through you, Mr. Mayor. Just remind Councillor Davinsky that we're also going to be talking about 6.2. Just a reminder that's regarding the garbage collection at 383 McNabb Street. And that's a recommendation that's coming out of those Committee of Whole minutes that you may wish to also state in your declaration.
Are you still there, Councillor Davinsky?
I can so note it in the minutes.
Yes, and indeed, thank you, through you, Mr. Mayor. Thank you to the clerk. Yes, whatever you have to do, do it.
Thank you.
Okay, so, all right. So you're declaring a pecuniary interest on 6.2, the Committee of the Whole report regarding the garbage collection at 383 McNabb and Saugeen Acres. Is that correct?
Yes, indeed. Thank you.
Okay, thank you. All right, so are there any other pecuniary interest to declare at this time? Seeing none, then we'll begin with adoption of the minutes. And we have the regular and special council minutes of October 25, 2021, the Committee of the Whole minutes of October 25, 2021, the special council minutes of November 1, 2021, and appointment meeting minutes of November 1, 2021. So I have a resolution that council adopt the minutes of the council meetings of October 25, 2021 and November 1, 2021, the appointment meeting minutes of November 1, 2021, and note and file the minutes of the Committee of the Whole meeting of October 25, 2021 as presented. Is there a mover and seconder? Moved by the Vice Deputy Mayor, seconded by Councillor Carr. Any questions or comments to any of those sets of minutes? Seeing none, all in favor? That is carried. All right, then that moves us on to report of the Committee of the Whole. And we have the first one, which is an infrastructure and development report regarding winter operations plan, Bruce Road 25 outlet, Southampton Water Pollution Control Plant. And I have a resolution. The council adopt the infrastructure and development report dated October 25, 2021, recommending the following. 1, approve the 2021 to 2026 winter operations plan. And 2, approve a request for proposal to be carried out for the design build of the retaining wall located at the storm outlet on Bruce Road 25, and that the cost be funded out of reserves, with approval delegated to the Director of Satisfactory Bids coming under $150,000. And 3, council endorse the Southampton Water Pollution Control Plant expansion draft environmental study report. Is there a mover and seconder? Moved by Mattson, seconded by Grace. Any questions or comments to the resolution? The Vice Deputy Mayor.
It's a quick question, Mr. Mayor, to Councillor Carr, perhaps Manafros. I know I keep asking this question about the final meeting for that group. Has a meeting been set for the County Road 25 committee?
Thank you. And through you, Mr. Mayor, I have spoken with Amanda last week, and as far as I know, we will be sending out a date and time this coming week.
Okay. Further questions or comments? Seeing none, all in favor? That is carried. Okay, then that moves us on to item 2, Committee of the Whole report regarding garbage collection at 383 McNabb Street and Saugeen Acres. And I have a resolution that council adopt the Committee of the Whole report dated October 25, 2021, recommending that staff be directed to grandfather and continue to provide municipal garbage and recycling collection to 383 McNabb Street and Saugeen Acres. Is there a mover and seconder? Moved by Grace, second by Smith. Any questions or comments? Seeing none, all in favor? That is carried. All right, then that moves us on to reports of municipal officers and committees. And the first one is a staff report on the municipal service delivery review recommendation report. And there's a resolution that council approved the department structure as recommended by Strategy Corps, and that council approved the incorporation of the funding amount of $329,271 into the 2022 draft budget, and to bring forward the projected 2023 amount of $397,705 to support the implementation of 7 net new positions by 2024. Is there a mover and seconder? Moved by Grace, seconded by Davinsky. Questions or comments? Seeing none, all in favor? That is carried. All right, that moves us then on to the second report, which is a staff report on Tremendous Communities Fund application. And I have a resolution that council directs staff to apply for the Tremendous Communities funding from Tree Canada to replace trees that were destroyed by the storm on September 7th, 2021. Is there a mover and seconder? Moved by Grace, seconded by the Vice Deputy Mayor. Questions or comments to the resolution? Seeing none, all in favor? That is carried. And finally, that moves on to item 3, the striking committee report on committee appointments. And I have a resolution that council adopt the striking committee report dated November 3rd, 2021, recommending the following. 1, that Councillor Davinsky be appointed to the following boards and committees: the Southampton BIA, the Bruce Area Solid Waste and Recycling Board, and serve as an interim member on the Lamont Sports Park Fundraising Committee. 2, that Councillor Mayette be appointed to replace Vice Deputy Mayor Mayette on the Saugeen Valley Conservation Authority. 3, that Deputy Mayor Matheson be appointed to the Westario Power Board of Directors. And 4, that Vice Deputy Mayor Mike Mayette be appointed to the Committee of Adjustment. Is there a mover and seconder? Moved by Grace, second by Carr. Any questions or comments? Seeing none, all in favor? Is carried. That moves on then to bylaws, and we have 6 bylaws in front of us this evening. Does anyone wish to have any of these bylaws taken out for individual consideration? Councillor Carr.
Thank you. I'd ask that 86-2020 be pulled out separately, as I'm declaring a conflict on that one.
Yep, that's reasonable. We'll do that. Any others? Okay, so I will deal with the list, and then we'll deal with 86 after that. So there's a resolution that the following bylaws are hereby read a first, second, and third time, and finally passed and sealed this 8th day of November 2021. 1, 84-2021 being a bylaw to authorize the entering into of a subdivision agreement with Lord Elgin Estates Development Limited for the development of Phase 7, Stage 2 of the Summerside subdivision. 2, 85-2021 being a bylaw to authorize a pre-servicing agreement with Barry's Construction and Insulation Limited. 4, 87-2021 being a bylaw to authorize an amendment to the collective agreements with the International Union of Operating Engineers, Local 793. 5, 88-2021 being a bylaw to amend the employment contract with the Chief Administrative Officer of the Corporation of the Town of Saugeen Chores. And 6, 89-2021 being a bylaw to confirm the proceedings of the council meetings of the Corporation of the Town of Saugeen Chores. Is there a mover and seconder? Moved by the Vice Deputy Mayor, second by the Deputy Mayor. Any questions or comments to that resolution? I will just note in follow-up to the comments made at the last committee of the whole meeting around the Lord Elgin Estates development and affordable and attainable housing. Have received some correspondence in the last couple of weeks from the developers there outlining the work they're doing on on advancing higher density rental units in some of their other lands across their developments. And I think I have been satisfied by those comments that they are moving as expeditiously as they can to advance those things, which is what I had hoped for, and I know what council hopes for. And so hopefully we'll be seeing some developments on that front before too long. If there's nothing further, then all in favor. That is carried. So then we'll move on and consider 86/2021, and I have a resolution, and I'm going to have it moved by Myatt and seconded by Matheson, if that's okay with Myatt and Matheson. That the following bylaw is hereby read a first, second, and third time and finally passed and sealed this 8th day of November 2021. 386/2021 being a bylaw to appoint an acting fire chief for the town of Saugeen Chores. Any questions or comments to that resolution? Seeing none, all in favor? And that is carried. Okay, and we will just say congratulations to the acting chief, Brian Johnson. And sorry, I'm just befuddled here because I've lost my agenda. Here we go. Okay, so that brings it to the end of regular council, and I have a resolution that this regular council meeting of November 8, 2021 hereby adjourns at 8:22 p.m. Is there a mover and seconded? Moved by Smith, seconded by Carr. All in favor? Council stands adjourned. Have a good evening, everybody.